Here we have a patient with a history of breast cancer, also undergoing routine surveillance imaging. And the way I have it set up here is kind of the old way that we would look at these studies. So we have the source images here on the left. These are our thin cuts. And on the right, we have the maximal intensity projection images. The MIPS as a means of detecting nodules has been around for decades. It is very useful. But quite honestly, the question is, can we do better, particularly in this age of developing artificial intelligence algorithms? So I just want to kind of scroll through first with, again, source images with MIPS. As we go through, again, this is a surveillance scan. We're looking for any evidence of metastatic disease in this patient. And at first pass on the thins, maybe not a lot is standing out. If you're like me, it usually takes a few passes as you're looking from one side to the next, or maybe you go do the entire right lung, then the left lung. And then again, looking from side to side with the MIPS, is anything standing out on the MIPS? And quite honestly, this is the way the study was read, and it was read as essentially no evidence of metastatic disease. Now, I would like to point out a couple of areas, and they are very, very subtle, but they don't show up well on the MIPS at all. And the first one is this area right here in the right upper lobe. As we look at this more closely, I mean, it looks like the vessel, as it starts to branch, it kind of thickens up, and that would be an unusual pattern. There are some small airways in that region, but they're not filled, so it's not mucus plugging. And oddly enough, in this patient, actually we have something similar, also kind of embedded right there at the branch point of the vessels on the opposite side. If we look at the MIPS, it's very hard. I mean, yes, you could say maybe there is something there, but a quick run through, you're not going to easily detect that. So now let's look at our vessel suppressed images and see how that algorithm performs. So let me just make sure that these are linked. Okay. All right, so now let's take a look at that area. So as we scroll through, again, vessel suppressed images on the right. As we come down, we're looking, and wow, the vessel suppressed images detect that there are actually two areas, one on the right upper lobe, one on the left upper lobe, where there's a questionable abnormality. Now again, the algorithm doesn't dictate what we say, but as radiologists, we have the autonomy to exercise our clinical judgment. And the best part of this is that it just draws your eye to say, hey, look at me. Is this something you want to comment upon or be concerned about? And quite honestly, on the ClearRead vessel suppressed images here, I'm concerned about this. And as I look more closely and intently at the thin cut images, I think there's probably something there. And in fact, just to maybe take another look, let's take a look at the coronal images in that area. And as we look, I mean, that is a nice round soft tissue nodule right embedded there with those vessels. Not really detected on the MIPS at all, but easily detected with the vessel suppressed images. And similarly, here on the left, we have a similar abnormality. So in this particular case, again, this patient has a history of breast cancer. She went on and had a short-term follow-up, and of note, the nodule on the right, which happened to be larger, it actually went away, but the nodule on the left continued to enlarge, and this was actually found to represent metastatic breast cancer. So again, a very nice example of the utility of a machine learning algorithm for nodule detection.